Since day one of our COVID virus crisis situations, we established a rapid response team, and part of my team members are my medical advisors. I'd like to introduce Dr. Mike Cruz, who's my medical advisor, and Dr. Jolene Uggan, who's my EMS COVID director. And they will be addressing you this morning.
Good morning. You all know me. I'm Dr. Mike Cruz. I'm the senior advisor to the governor for the COVID medical response and also the Guam state surgeon. As a soldier and a surgeon, I can tell you the toughest part of the job is losing somebody under your care. Today was my duty to report to Governor Lou Leon-Guerrero of our first COVID-19 related death at 0130 this morning. Let me hand the mic over to Dr. Jolene Uggan. She can give you more details, and I'll come back on later for more information.
Half a day. GMH had an admission with a 68-year-old female who had multiple comorbidities. She came in with fevers, chills, and shortness of breath. She had no travel history. However, she did have contact with a traveler. Patient had before she could clinically decline, the patient and her family had made the decision not to undergo any extreme life-saving measures. And so over the past 36 hours, she was placed in comfort care, and she passed this morning at 0130 at GMH.
As we mourn our first death, we must know that work does not stop and cannot stop. As of March 21, a total of 15 cases have tested positive of 103 that have tested negative for COVID-19. All 15 confirmed cases were kept in isolation, either at GMH or at home temporarily until transfer to the skilled nursing facility, which took place on Saturday. This was done in accordance with the U.S. Centers for Disease, CDC, and prevention guidelines and precedents set by other states. Those who were temporarily placed on home isolation were subject to monitoring by the public health staff, which included home visits and regular phone calls to check in. We know now that there are 15 confirmed cases. 6 are in their 60s, 3 were 50s, 3 were in their 40s, 2 were in their 30s, and 1 is in their 20s. 5 of the first 14 COVID cases have had recent travel, most of which is linked to the Philippines. There is strong evidence that COVID-19 cases have spread throughout our community and has affected residents in the northern, central, and southern villages. Even as we speak, we have a team of community physicians that are meeting as part of the physician advisory group to the governor just at Government House. These are local physician leaders, including Dr. Nathaniel Berg, Dr. Juan Nguyen. What we can do isn't dramatic, but it will work. Maintain social distance, wash your hands, avoid touching your face before your hands are clean, and always maintain good hygiene. People of Guam, we need to take this serious. Let me be clear. We mourn those who have lost so much, but our sadness is not a loss of faith. We are tired, but we will not give up. We have survived so much, and we will win this war together.
I would also like to emphasize that we have gone through many, many aggressive actions to protect our people. But nothing is much more important than you staying home. Please stay home. Let's write this together. Thank you.
Now, if you would like to make a question, to give a question, please raise your hand in the chat.
Can you hear me? Hi.
Hello.
Who's speaking?
This is Marvick. I don't have a video, and I'm not sure if you can hear me.
We can hear you, Marvick.
Okay, I have a question. Given that there's no cure for COVID-19 yet, How are the patients being treated right now?
We are providing supportive treatment, as we would with any patient who had an infection.
Any other questions?
Yes.
Hi,
Kevin, can you hear me? This is Kevin at the Pacific News
Go
Center.
ahead, Kevin.
Can you, at this point in time, apparently we have 14 surviving COVID-19 cases. Is that correct? And if so, where are they? Can you hear me?
Yes.
Yes. Well, I'm asking, where are the remaining COVID-19 cases? Are
One
they?
second. We're bringing up Linda DeNorsi to answer your question, Kevin. Just give us 1 second.
Hang on, Kevin, we're getting Linda.
Thank you.
I can speak on behalf of the census at GMH. We have 4 COVID positive patients within our facility with the SNF COVID isolation facility.
We also have Lillian here, Lillian Posadas from GMH.
We also have about 4 COVID cases in the Tier 2 area. Tier 2? 4 total.
Lillian, hi, this is Nestor. Lillian, are there any other patients that are in critical, serious condition?
Not that we know of, no, they're stable.
So this patient, apparently the distressing condition came on pretty quickly?
No, the patient presented to the emergency department by personal vehicle on March 14th. The patient was admitted on March 15th. At 01:30 this morning is when the patient expired.
Nick Delgado, can you say how many of the deceased friends, family, healthcare providers were tested?
I'm sorry, can you please state your name and where you're from?
Nick Delgado with the Guam Daily Post.
Okay, and what is your question?
How many of the deceased patients' friends, family, healthcare providers, if at all, were tested?
How many of the deceased, if at all, were tested? Friends and
It's surveillance. Linda.
question is how many of the
How many of these friends and families were tested? That's your contact tracing. This is family and
friends. Linda, can you
Okay, what was the question? I'm sorry.
friends and family, if at all?
Yes.
How many
Of the one that died, 1 has been tested already and been found to be confirmed positive. Yes,
And the rest?
and the rest
the rest are okay at this time and they're fine.
surveillance?
Yes, and right now.
I have a question.
Continue to get them all from the voluntary into the involuntary, and so we're moving them continuously, 1 at a time, to the SE.
This is Kevin at the Pacific News Center. Can you hear me?
Yeah, can you raise your voice a little bit more? We can't hear you.
Kevin at the Pacific News Center. I'm still looking for a breakdown of where the current COVID-19 infected patients are staying. 4 are at GMH.
Yes.
The rest are at
Kevin, we'll get you those answers. We're right after this press conference.
I just have a follow-up question to the deceased patient. This is Nick with the Guam Daily Post.
Nick, can you speak closer to your mic if you can?
Yes. And so my question is, what happens with the patient's body at this time? Across the globe, there's been uncertainty of what would happen with the patient, whether someone would want to move forward with cremation or funeral services, or what would happen. So what's the next step?
So, Nick, by law, they have to be buried or cremated within 24 hours. And so we are already working with the family and the funeral home, the mortuary. And the churches are also aware. What the Archbishop has instituted is that for funerals, they're going to be private, family related. So I have not had a discussion with the Archbishop, but I will, so we can make sure that we follow the protocol so that there is minimal contact with the public.
Thank you, Governor.
Hi, this is Nestor. Did the patient have any underlying conditions?
Yes, it was comorbidity. So multiple conditions.
What can you break those down into layman's terms, doctor?
The patient had end-stage renal disease, hypertension, end-stage renal disease requiring hemodialysis, hypertension, hyperlipidemia, and diabetes.
So how much of a factor then did the her COVID infection have, given that she had all these other conditions?
I don't understand the question. So let me make a statement. Patients with multiple comorbidities, especially end-stage renal disease and diabetes, at baseline are already immunosuppressed. So any infection, regardless of COVID-19, will cause what's left of her immune system to continue to decompensate. Does that make sense?
Yeah, that answers the question.
Okay.
This is Kevin.
I want to re-emphasize
Linda DeNorsi.
all the data and the global data that's happening. CDC has come out, World Health Organization have come out, that 8% of those that are infected with COVID-19 have mild or moderate symptoms. And those that have fatalities, for the most part, I think they say like 90% of those, they are individuals that already have immune suppression. So that, like Dr. Uggan said, they had diabetes, they have hypertension, cardiac disease, they have cancer, they have stroke. So everything that diseases that can cause your immune system to be minimized. And that's why, I don't remember who asked the question, but that's why, Nestor, that we are very adamant that everybody stay home, and that if you have elderly population with you, do not have contact with them. It has also been shown that people really who are most vulnerable are the elderly. And so the most vulnerable is 80 and above, but then 70 and above, 60 and above are also vulnerable. So younger people that have the disease will be more likely to be mild to moderate. And that's why we say stay home, take care of yourself, rest, and please don't have any contact with people then you don't need to have contact with.
Hi, Sabrina from KUAM. I had a question.
To make that message, I also appreciate media. They have done really good things. PNC, KUAM has done really good educational programs. So I need US media people to emphasize, stay home, wash your hands, cover your mouth when you're coughing, and when you're sick or you feel like you're sick, call your doctor before you go to the clinic or the ER. Those are the major things. Our people, ourselves, you guys are going to be the key to helping us eliminate this virus. So I ask the media to please make your role be that you are always saying stay home. And I know for the most part you guys do.
Okay, Dr. Jolene,
I
I'm
have
going
a question.
to make a statement. Dr. Jolene, go ahead, please.
Can I make a very, very strong recommendation that we need the media to help us with? The most up-to-date site that we have used is the cdc.gov. And there's information in the cdc.gov that allows people who cannot read, visual learners, there's pictures for patients at home or for people who get sick, what they should do. And I push the CDC because it's constantly being updated. And to put that in your media every day, twice a day, all day, to get it out to the community, because some people don't have the same kind of technology as others. So the newspapers, the media, whatever you can, get that information out there so that it can educate our community on what to do.
Hi, Sabrina from KUAM. I had a question.
Okay,
Can
go
you
ahead.
hear me?
The last
Can you-
question. After this, we will go ahead and take questions and answer them through the Joint Information Center.
Okay, I didn't hear you, but can I ask a question?
Go ahead, Sabrina.
Okay, I just wanted to ask you, you mentioned the 68-year-old woman, she had contact with a travel patient, correct? Do they live in the same household?
Traveler, not a traveled patient, a traveler.
Traveler, oh, I see. And you said, is that traveler, was that person tested?
Yes, she was tested and she was tested positive.
The traveler tested positive?
Yes, ma'am.
Okay, are they from the same household?
Yes. Oh, no, they're
They
not.
are from,
Our CDC surveillance people say they are not in the same household.
okay. Anybody in the 68-year-old woman's house also test positive?
Sorry, what was the question again, Sabrina?
The 68-year-old woman, did anybody else in her household test positive?
No.
Okay, as for the traveler that she had come in contact with that you said tested positive, anybody else in that household test positive?
No.
But you did say that that the patient who passed away, her family member did test positive earlier, correct? This is Nick with the Post.
That's correct.
So could the government or anyone have done more or anything sooner to prevent a fatality from hitting our island like this?
So the government, was that Nick?
Yes,
Could
it was.
more efforts have been taken on sooner to prevent a
So
death
the
happening?
government has quarantined people. The government has denied cruise ship vessels to be ported here. The government has closed down for just non-essential personnel. The government has closed bars, restaurants, every public spaces that we can think of that results in congregation. As far as the care of the individual, I think Dr. Uggan is much more of an expert in it, and so she can give you basically her information.
The patient made the decision very early that should she need extreme measures, life-saving measures, that she did not want that. She did not want to be on life support.
Okay, Dr. Mike Cruz is going to give our closing statements, and then we will end this press conference.
This statement is to the people of Guam. The healthcare community is taking this very seriously, as the government of Guam does. You as a people, we need to take this seriously. Practice social distancing and good hygiene, keep your hands from touching your mouth. And if some of you have some masks that are going out, wear those too. But please, please take this seriously.
And stay home.
Thank you, everybody.
Thank you.
Thank you. Everyone just joining us, thank you so much. This is Nick Delgado Coming to you from my home, as many of you have just been told by the governor herself to stay home, stay inside, especially if you don't need to go anywhere. The first confirmed death of the first 15 COVID-19 cases this morning here in Guam. And so we, of course, have all of the details already on postguam.com. Stay safe, everyone.